All right, everybody, I'm going to go ahead and get started. I have 2 o'clock straight up on my phone. So I want to be respectful of everyone's time and want to go ahead and start the presentation. My name is Brian Dowd. I'm the Deputy Executive Director over Medical Assistance Plans at the Department of Community Health. And I have been the business owner for EVV for quite a few years now. We did not do a public town hall last month, but we have done public town halls since November 2 years ago. We started November 2020. We did a public at least 1 town hall, often 2 or 3 town halls in all of 2021. And we will likely be doing town halls as we move forward on a monthly basis again, if not monthly, every other month. So we really appreciate you guys joining us, and thank you for joining us today. I know I say this in most of the public forums, but it really does help with improving and enhancing the system, and it's a great way to get feedback and just to get everybody on the same page with what is happening. We start every presentation at the Department of Community Health with the mission of the agency, which is to provide Georgians with access to affordable quality healthcare through effective planning, purchasing, and oversight. So what are we going to go over today? We're going to do some operations updates, which includes our status, key statistics, timeline, and current billing exceptions. We're going to do some common issues in operations and frequently asked questions. We're going to give you our phase 2 implementation update, which is for home health. We're going to do the third-party EVV vendor update, which is a little new this time. So I'm glad, folks, we got a good 185 people on the line. We're going to be telling you how to contact the call center. And then hopefully at the end, we'll have enough time for some Q&A. Any Q&A we don't get to, we will do what we always do, which is summarize those questions, put it out for FAQ, and try and respond to those individual questions to the individual source on anything we cannot answer. So let's start off with our operational updates. On February 9th, 2022, it is important to note that our EVV system was certified by CMS. So CMS is the Center for Medicare and Medicaid Services. They are our federal partner. They pay for 2/3 of our claims, and they are the federal wing of our operations. Medicaid is largely funded by federal tax dollars. So they are like the big boss in Medicaid. And we were one of the first states in the nation to be certified for EVV. And we believe we are the first state to be certified based on key performance indicators related to outcome measures, which is the new way that CMS is judging EVV systems. So it is a large achievement for the state. It is, again, we are one of a very few handful of states that have received certification. We believe overall less than 10. I'm not sure it's not less than 5. And it does help us with things like outcome statements, evaluation criteria, and key performance indicators. So that is a major milestone for the state of Georgia in its EVV operations. So we wanted to give you some key statistics because I think sometimes people are, it's very difficult. And I'll just tell you, I talked to a family member this morning from nothing to do with EVV who was trying to get services for a family member of theirs. And they were very, very frustrated and rightfully frustrated because what they felt like should be working well wasn't working well. But then they extrapolated that to the fact that nobody gets anything out of Medicaid. And I was very much validating her concerns and problems and issues. But I did eventually have to say, we spend billions of dollars in Medicaid every year annually. So while I appreciate and validate what your concerns are, you can't extrapolate it to the whole system doesn't work. So we like to do some key performance indicators for folks to kind of reinforce that in the EVV world. You may be frustrated with a member not showing up in the system or some sort of issue that you are reporting to us. But you do also need to hear the fact that 86% of PSS and CLS claims submitted through EVV or submitted through EVV in December 2021. So out of all possible claims, 86% were successfully run through the EVV system. Only 14% of claims were billed outside of EVV with either a tier 1 ticket or a cost share issue, or somebody just billing outside of policy and guidance. So the vast majority of claims that we are now receiving are correctly running through the EVV system. We have captured over 2 million completed visits since the start in EVV. We have over 1 million submitted claims in Georgia for required personal support and community living support services. And we've had a provider who submitted over 50,000 claims through our system already. Actually, a lot more than that at this point, because that's a couple months old. So a vast majority of our claims are correctly running through the EVV system and working appropriately. So let's give you a little update as far as where we are for PSS and CLS timeline. The system became fully operational April 1st, 2021. So in just another month, less than a month now, we will have been up and operational for a full year on EVV. So a full year available to utilize EVV. November 1st, 2021, providers were required by policy to submit their EVV claims through the state system unless there was an exception, unless you met one of the criteria for exceptions in November. As of January 1st, we briefly put on a mandatory claims edit for a couple of weeks. We will be putting on that mandatory claims edit again in the future, but we do not have it on right now. But all claims are still required to go through EVV unless you are billing for one of the exceptions. And this is something that folks get confused about a lot. The claims edit is not on, but the edit is set to pay and report. Sometimes you guys will send me claims edits and you'll say, this is denying because EVV is denying it. No, they are not. If you look to the left of the claims edit, it will show that it paid with a P. You have to go down in that claims edit listing to another claims edit, which will have a D next to it. And that was the reason your claim denied. And it's very frequently you're out of units, the member isn't eligible for Medicaid. There's lots of different reasons that you guys send in to us. And when we review it, it is for other claims denial reasons. So make sure you're looking at those, all the claim denial reasons are on there. You may also know that I have staff now that are reviewing everybody who is not billing through the EVV system. And they're reaching out to providers to ensure that the reason that they are billing directly to GAMUS is for a tier 2 ticket. Now that we no longer have cost share, and we'll talk about that as a problem, we'll talk about that in just a minute. So they are auditing the pay and reports, and they are reaching out to providers just to ensure that the reason that they are billing to GAMUS directly is due to a tier 2 or tier 3 open ticket. And again, we do go back to our tier 2 and tier 3 tickets, and we verify that after we have spoken with you. So that brings us very nicely to our next slide, which is what are the current billing exceptions? So as of January 1st, 2022, there is one, as of today, there is really one valid reason for billing directly to GAMUS. And that is because you have an open tier 2 ticket with EVV. You have called the call center. You have said, this group of people, these members are not showing in the system, or whatever your issue may be. and they are saying, hey, we can't fix that problem for you right now. We've looked into it. We can't fix the problem. So we're going to be opening a tier 2 ticket. That tier 2 ticket is 1, 2, 3, 4, 5 so that you have it. You go, okay. Then at that point, you may then bill through Gainwell directly for your claims. But it is only with that tier 2 ticket where you have a valid reason to bill directly through to Gainwell. Cost share has been corrected in the system. So if you have members with cost share, you need to immediately start utilizing the EVV system for capturing the visits and claiming to EVV, to GAMUS through EVV. So the claims exceptions a lot of people are asking, do they require manual intervention to override the edit for PSS and CLS process? They don't deny when directly submitted. Again, they will pay and report. But if you do have a direct denial, you can please then submit those to us at the EVV mailbox, and we will research them to ensure the reason behind the denial and follow up for you. So let's talk about some common issues and frequently asked questions. Again, we're still getting a good number of questions around rounding rules, and we use the Medicare rounding rules. So up to 7 minutes, if you're billing for a 15-minute unit, up to 7 minutes will round down. 8 minutes of completed service will round up. So, all the way up to 7 plus, like 7:59 goes down, 8 goes up. Same thing with 30 minutes. 29:59 will round down, 30 minutes rounds up to the next whole unit for any service that is billed hourly. So 8 minutes or more goes up, 30 minutes or more goes up for an hour unit, 8 minutes or more for 15. So let me give you an example, because these are real examples that came into us where people thought it was doing it wrong, but we walked them through that and they understood it was right. Aide clocks in at 12:58 for a 1 p.m. shift and clocks out at 3:10. That's 2 hours and 12 minutes on a 15-minute unit. That equals 9 units because you have 2 hours and 12 minutes, which is above 8, and it's going to round up. Aide 2 for another visit clocks in at 12:58 and they clock out at 3:05. This is 2 hours and 7 minutes. So they're only going to get 8, which rounds down to 15 minutes. So you do have the ability within NetSmart to go in and adjust those times if they were incorrect. But it's important from a Department of Labor standpoint and from a Medicaid standpoint that we pay for the time that correct services were delivered. So it's important to have that conversation with both your staff and your members to know that if they're getting an extra 15 minutes here or an extra 15 minutes there, that does count to their overall PAs for the month. Billing still, as it always has been, reports through the GAMUS system. So you need to make sure that when you're monitoring your claims, that you're looking to see that the claims were paid, suspended within the GAMUS system. Adjusted or partially claims, you are also going to look through the GAMUS system and look to the GAMUS system to see your reasons for denials, for any edits that come up. You're going to want to look at your remittance advice to make sure that every single person you have billed for, you are appropriately paid for. We're still getting a few issues around mobile app issues, saying that the GPS isn't working right, that a member is actually clocking in at the member's house and you're hearing the member on the phone, but it's clocking 10 miles away. You can call the call center and they will help you with calibration of your phone if you need your phone recalibrated to make sure it's working correctly. Here is the biggie that we keep hearing about, and there were 5 or 6 questions before we started this presentation. Missing members and missing prior authorizations. This continues to be a large thing that we are working with every single day. Again, keeping in mind that 86% of the members are processing appropriately for December. So in the 14%, a large portion of them that we are seeing is missing members and missing PAs. So EVV cannot add members to your system, and it cannot update PAs in your system. And you can't do that either as a provider. Those have to come directly from GAMIS. So the information must be correct on GAMIS first before EVV gets updated. So you need to first check and make sure that the member's PA is updated in GAMIS with you as the service provider and the correct number of units are on it. Now, let me tell you what we're seeing over and over and over again right now. We're getting people calling and writing in and saying, hey, these members have an active PA, but they're not showing up in EVV. When we are going back and looking in the system, the members have QMB only, Slim B only, or QI1 only. Those members do not have the right category of Medicaid in order to be eligible for those waiver claims to be paid. So they are PMAO people in the old terminology that need a waiver category of aid added before you can bill either through GAMIS or through EVV. And we are seeing this over and over and over again. I probably have seen 100 members over the last 2 weeks that have been reported to us as they're not in EVV. Well, the reason they're not in EVV is because we're not going to send them to EVV until they have a proper aid category in order to participate in the program. So you need to make sure that you're following up with the member and with case management to ensure that they're working through the DFACS eligibility process in order to be approved to receive the service. In the meantime, you need to be capturing that information on paper so that it can be administratively added to the system at a later time. Now, there may be other reasons why missing members are not showing up. We have seen specialty codes missing from provider files in multiple provider files. It just probably was a mistake when you registered. You didn't select all of your specialty codes for personal support services, and that has caused for the members not to come over on the file. We are in the process of correcting that. We've seen name mismatches where the names don't match what's in GAMIS from what is being submitted. So we have to get those name mismatches fixed. We have seen in about 30 cases, the PAs were updated with spaces in between the modifiers. So it may be 10 T1019 TF, but the PA has T1019 space, 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 empty, then TF. And that won't pull across on the file either. We are correcting those as well. Any one of these things may be the issue. And we are learning these things from you all calling the call center, us opening a ticket, us tracking the ticket, and us following those tickets through the process. So that's why when you contact me, when you contact the EVV call center, I constantly go, have you reported this to the call center? Have they opened a ticket? What is your ticket number? Because we use that to refine and modify the system. Just a reminder that the claim submission deadline is Thursday at midnight. That's when the file goes off to GAMIS. So to be included in the normal weekly cycle, you do need to have those claims submitted by Thursday at midnight. I'm still getting a lot of questions about the source CCSP and ICWP 10% rate adjustment. Those aren't right in EVV, and it is right now in GAMIS. We are working to do the mass adjustment back to July 1st. Although that mass adjustment is not an EVV issue, I know it is a very important issue for this audience. So I want to assure you that we are working on it. We have started working through a draft to make sure that the claims are right. So y'all are aware it's 1.2 million claims. So it is a very large lift for the department to go through and ensure that it is working correctly. But please be assured it is a top priority and we are working on it. Again, we want to emphasize that certain functionality continues to exist in GAMIS. You should be looking at your claims advice. You should be doing a status review of claims, voids, adjustments, looking at your service units or prior authorizations. You can access the GAMIS website with questions at the link that is provided in this presentation. And many of you will know that if you contact me about basic billing questions, I'm going to deploy a GAMIS representative to provide training and technical assistance to you in how to bill, in how to read your remittance advice, and how to understand your claims denials. There has been a lot of good work as a result of EVV in educating providers that never have seen their remittance advice, have no idea how to do claims denials. So we continue to afford providers that sort of technical assistance through GAMIS. So let's do a little brief update on home health. So the second phase of EVV is home health. And it is specific only to category of service 200 and the home health services contained underneath home health. The mandatory go live date for that is January 1st, 2023. We will be registering, training, providing a soft launch, and then the mandatory go live, just as we did in phase 1. We have not started the process of full-on implementation of home health. We have just started the educational piece where we're reaching out to our pool of providers, which is a pretty limited pool of providers. It's not like phase 1, to let them know that it's coming. We are beginning to work with our CMOs because our CMOs, our care management organizations, also provide home health services. So we are working through them as well to make sure that they are ready for the January 1st, 2023 deadline. Okay, let me give you an update on where we are with third-party vendor updates. So we are going to be closing third-party vendors, closing the system to new third-party vendors. We have more than adequate choice for providers at this point. And we never intended for the third-party pool to be open indefinitely to providers, to new third-party vendors to come on board. As you guys are aware, you can use the NetSmart system for free, or you can choose to go out and purchase a third-party vendor that then integrates with the NetSmart system. So we need to know by March 31st, 2022, if there are any remaining third-party vendors that would like to integrate with the NetSmart system. If they have not signed that form that says they plan on integrating with us, by March 31st, 2021, we will be closed for business and third-party vendors at that time. As if they have between April 1st, or some are in the process now, in June 30th, 2022, to fully complete the integration process with NetSmart. As of June 30th, 2022, we will be closing down third-party integration work and closing our pool of third-party vendors. And you may be saying, well, you're closing your pool? Yes, because we have this many third-party providers for folks to choose from. Not only can you use the NetSmart system, which you see right here, it's one of the ones that are on the thing right above Rosemark, and right below my EVV is NetSmart. But all the rest of these providers are integrated with us, and you can choose to pick from if you choose. That gives you a total of 36 options for integrating with EVV, including, and that does include the free state NetSmart system. So you can choose the state-sponsored NetSmart system, or you have 35 other options to choose from, plus anybody who integrates with us between now and June 30th. We want to remind you how to contact the call center. A lot of folks contact me directly, either through my personal email, or they call my office, or they send an email to the EVV mailbox that is monitored by DCH. That is fine. It may take 5 days for me to respond to those emails. That's kind of our standard of promptness in the state, 5 business days. And a lot of the times when I do go back to it, what you will see me do is simply copy the call center and say, hey, can you please provide your agency name, Medicaid ID, NPI, ENI, contact information so we can get back with you on this issue. We will need those members that are missing if you have missing member, and the GAMUS PAs so we can look at those GAMUS PAs to ensure that they are in the system and working correctly on the GAMUS side. So please do make sure you're calling the contact center first before you are contacting the state. If you have issues or concerns with the call center, you're welcome to reach out to us. We do have a full-time monitor of the call center. A staff member of mine that monitors the call center at all times, can pull calls, can evaluate calls for process improvement, whether that be on the provider side or the call center side. We also have weekly meetings to go over what are the common things that are happening in the call center. We also monitor according to metrics that are in the contract for the provider to ensure that the call center is operating appropriately, and we take liquidated damages when it is not. So we are fully monitoring the call center at all times. But please do start your concerns, questions, comments, complaints with the call center. Again, this is just the call center information. We're just reinforcing that one more time. I'm going to pause for just a second, and then I'll start going through the information that is in the chats for Q&A. Let me get back up to the top. So the first group of questions says that when they submit a ticket to Conduit, that you guys always are attaching the missing member and PA from GAMUS, and then Conduit is re-asking for that information. And then a few days later, they're asking for an email to make an appointment to do a screenshot to look at both of those. So it is important to know that Conduit does not have access to the GAMUS PA system. That is something we are working on, but they frequently need that information, and then we have to go back and research it to make sure that everything is available in the GAMUS system. That's why it's really, really important for you guys when you are looking at your missing members to ensure that that PA is for you in the system, and that that member has an appropriate aid category, whether it be SSI or a Title 19 waiver category that entitles them to full Medicaid benefits and the waivered services before you're contacting the call center and saying, here is my missing member. But we will research those and get back to you. Somebody else is agreeing with that. How long does it take to escalate new missing members to Tier 2 level? And the person is saying we've had missing Tier 2 members for quite a while. It really depends on what your issue is. If your issue is the fact that you have something wrong in your provider file and your specialty code isn't checked, then that takes us updating your provider ID information and passing the information over on a special file. And that could take several months. If you're using a third-party administrator, one of our approved third parties, and they're having issues, that may take coordination between them and us. So we don't really have a set timeline. It depends on what the issue is that's causing the interface. That's why we allow you to continue to bill through GAMUS while you have a token tier 2 ticket, so you have no impact. You are able to get paid. So that's whether it's 1 month, 2 months, or however long it takes for us to get resolved. As long as you have an open tier 2 ticket and we have not shut it down, you can continue to get paid through GAMIS. So yes, if somebody says that the next question is, we've gotten an email to inform us that a member is in a tier 2 team, that's the same thing as a tier 2 ticket. You can bill for that member, and you can always call the call center to get that tier 2 number. I think I've discussed why members are not showing up in the system, so I'm going to go through that again. Fortunately, it sounds like a couple of people haven't been able to hear, and other people have been able to hear. So that's really good. There were some, I want to thank folks for providing alternate phone call in to hear as well. The next question is it possible to receive a copy of this presentation? Every single presentation we post to our EVV website. And we have done that since we started back in November. So rest assured, this presentation and the recording from today will be posted to that website. And you can go back and listen to all of the town halls back to November of 2021 if you want to go through the history and, you know, just get some good Q&A. When are we going to fix the issues with modifiers? Modifiers should self-correct from U4 to U5 if the EVV isn't. No, it should not. So no, the system is not set up to self-correct what is billed over if time goes over. So you're welcome to send me an email directly and I can discuss that with you, and we can have a further conversation about what's going on in your system. And we need to make sure that for the T2025 rate increases, y'all, GAMIS bills, I mean, the PAs come across at the highest level. That's how Beacon and DBHDD sends us the PAs and authorizations. But each of the T2025 codes and modifiers have a specific rate that is attached to them. We've had a lot of people contact us and say, I should be getting this high rate that I see. Well, no, you need to be making sure that the rates that are associated with your codes are appropriate for what the current cost is. And if you have specific issues with that, we can have somebody reach out to you and walk you through what the proper billing is supposed to be. So feel free to write the EVV email box, and we will get that started for you. My clients are not in the EVV system. The current rates have been loaded for both EDWP and Now and Comp. We just received approval this week for the additional 5% increase for Now and Comp. It will take roughly a month for that 5% increase to go into EVV, and it will take longer than that for the PAs to be updated through Beacon. But we are working on that rate increase. So let me say this, because the next couple of questions are about being frustrated because they don't feel like the system is working correctly. So I want to assure you that if you are receiving poor performance from EVV, from the call center, please write me with specifics. Write me with when you called the call center, who called the call center, and what you feel like the issue was. Let me tell you what we do from there, though. We pull the calls and we validate what happens. And then we take appropriate action based on what happens. So if the call center has an issue, we address it with the call center. If the provider has an issue, we address it with the provider. So if you are having poor performance from the call centers, please feel free to write us. And we will do that, look back and follow up on it. You have the next question says it has two members that are not in TELUS, but they both have a cost share. How do I get these two members into TELUS? If the members, again, this is another missing member issue. If you do have a missing member and they have an active Medicaid case on GAMUS and an active PA in the system, you can send that directly to the EVV call center, and it will be researched and a ticket will be open. The next question is requesting a town hall specifically to self-directed families. We haven't done one of those recently, but we can put that on our list to have another town hall specifically targeted to self-directed families. We have done that previously, but thank you for that suggestion. We can update that. Do I have to have a PA to EVV each time it is updated to receive correct pay rate? Yes, any changes in your PA have to be updated from the source system to GAMUS, and then it comes across to EVV. So if units are being updated or anything is being updated on the PA, it starts with GAMUS, and then it comes across to EVV. Unable to match, not just me who is having billing issues. How long is a provider is considered tier 2 ticket? So again, I want to reinforce with folks, absolutely 86% of claims are coming across properly. 86% of claims are working correctly and appropriately. So there is a 14% out there where we are seeing issues that are having to go through GAMUS. That's just being fully transparent. But there are providers who are billing all of their claims all the time through EVV without issue. So there are others that are just now getting started. Maybe they're a new provider, maybe they're somebody who bought another company, or maybe there's somebody who just didn't hear about EVV until we put on the mandatory claims act. They didn't start last April with the process, so they absolutely are having a lot of run up, and their billing issues are definitely something that they are having more trouble with. So the next statement is the claims are getting denied through GAMUS even with a tier 2 ticket. That's an issue other than EVV. So you need to go down your claims edit and see what the reason is that the claim is being denied. And if you need to contact GAMUS, they will send somebody out to you to help you understand the EVV claims denial reasons. Again, the claims are not denying for EVV. The claims edit is set to pay and report, which means it automatically passes through for not going through EVV, but it kicks out on a report for my staff to audit. There will be another edit line down below that goes through the reasons for which you are denied. The next question is, can we start service when the member is not listed on the portal? You can. You will just need to capture that information manually like you have done in the past. So again, I'm going to ask folks who think modifiers should be self-correcting to contact me directly. One provider has entered that several times here on the chat, but we probably need to have a one-on-one on that question. Again, there's several questions here that are about well, I have a tier 2 ticket, how long do I bill through GAMUS? That's a really great question. You can continue to bill through GAMUS until which times that you are told that your tier 2 ticket is resolved. Then you should verify that your tier 2 ticket is resolved, and then you should bill through EVV. At that point, there's no reason why you shouldn't, right? Your members in the system, your staff can use the system. You should be able to bill directly through EVV at that time. If you are having modifier issues and you're using a third party, we're still getting what your PA is in EVV. So you need to make sure that it's right on EVV. And if not, you need to call the call center. We will then tell you if it's a problem with your third party system. I'm going to go through a few of these because we're kind of asking the same question over and over again. So if you don't have right members or right PAs, you need to contact the call center so they can open a ticket and we can track the tier 2 ticket. Even if it takes 2 or 3 weeks and you have to continue to bill through GAMUS. Okay, I think we have a lot of the same issues here. We'll go through these and make sure they are correct in the system. We'll respond back to those who need it. You are also welcome to write the EVV mailbox and we will respond to each of these questions directly and do some auditing of providers here. So I want to thank everybody for their continued participation and the questions we are seeing online. This has been very, very helpful and it continues to be very, very helpful. If you did not get your direct question answered, please submit that to the EVV mailbox so we can do proper follow-up. I want to also offer this as the last thing I talk about. If you need to set up, and I've said this for over a year, if you need to set up one-on-one time with myself and EVV staff to walk you through your issues, we are more than happy to do that. Please just reach out to the EVV mailbox and request that time, and I will sit down with you specifically to go through your issues. So I want to thank everybody for their time today and their participation. It does help us clear up, modify, and correct things in the system. I hope you have a wonderful Wednesday and a wonderful rest of your week. Thank you.